This is a presentation on the Navy and Marine Corps Public Health Center Technical Manual 6220.12, Medical Surveillance and Reporting. Quick look at the SSIC code assigned to this technical manual. The 6000 series, that means this has to do with medicine. The 2 in the primary number spot right here, that means preventative medicine. And this 2 right here in the secondary number, that means it has to do with communicable disease. And as you'll see as we get into this technical manual, this technical manual is all about our medical surveillance that we have to do to look out for communicable disease, and when we encounter communicable disease, what our reporting requirements are, right? So that's why it has to do with the prevention of disease and communicable disease. That's why it is labeled like this. A quick introduction to the chapter, right? Commanders are at all levels are expected to maximize readiness by taking every reasonable measure to protect their personnel from disease and injury. The way they're going to go about doing this is through the medical department, because the medical department is going to supply personnel to provide commanders with a health risk assessment. Right, so before we deploy anywhere, before we go on a long field operation, the medical department is responsible to brief the commander on the health risks that we expect to encounter when we go on these operations. Not only are we going to provide that risk assessment, what kind of diseases are present, what kind of injuries are we going to be prone to, what kind of environmental factors we have to worry about, but we also need to provide what's called the force health protection recommendations and the force health protection programs, right? The things we recommend as a medical department to preserve the health of the unit. So an example of this, we're going to somewhere where anthrax is very prevalent, or smallpox might be a risk, or yellow fever. So as a force health protection measure, we're going to say, hey, we've got to give these immunizations. Or we're going to go somewhere where malaria is a risk, right? So we're going to look up what types of malaria we have there, whether or not we have any kind of resistance, and our force health protection measures are going to be getting somebody on the proper prophylaxis, like getting somebody on doxycycline, for malaria prophylaxis. So medical surveillance, we're going to define medical surveillance as a medical department's efforts to capture and collect individual and population health status indicators, disease and injury data, and medical interventions to permit analysis, interpretation, and report of population-based information, and reporting of population-based information, meaning when our people come in, right, when we're going to, not only are we going to do things to kind of help prevent disease, but when we're treating our ill members, right, when we're treating ill personnel from the unit, we're going to track on what kind of diseases, right, what kind of symptoms we're seeing. That way, that information can be analyzed to see if we're trending abnormally high than what we otherwise would. They have set numbers for the size of the unit, the type of operation, how much, gastrointestinal illness should we see? How much nausea, vomiting, diarrhea should we typically see on these types of field exercises or these types of deployments? And if our numbers are exceedingly high, we're going to start to suspect that maybe something else is going on there. Or if we have some people coming in with unusual kind of like flu-like symptoms, at much higher rate than we would normally suspect, we might, start to wonder if maybe a biological weapon's in play or if something's going on that we were unaware of. So that's why we collect medical surveillance, to get that data. The purpose of this manual is to provide basic medical surveillance procedures and reporting requirements for Navy Medical Department personnel at the unit level. The two types of surveillance reporting we're going to cover are what's called a reportable medical event, right? Certain illnesses that when people come in, we have reporting obligations, and we'll talk about where we report them to. And we're also going to talk about what's called syndromic and categorical injury. And we'll get into each of one of these individually. We're going to start with what's called a reportable medical event. So a reportable medical event and RME are events, usually diseases or agents, which pose inherent significant threat to public health and military operations. They have the potential to affect large numbers of people, to be widely transmitted within the population, and they have severe and even life-threatening clinical manifestations, and because of that, they have the potential to disrupt military operations, okay? Something like tuberculosis, highly contagious, and can be debilitating. Especially you get an active pulmonary tuberculosis, you know, that person is not going to be combat effective. Not only that, it's highly communicable, it's going to spread throughout the birthing. It's, you know, that's how we live usually in the military, in close quarters. So we've got to take that into consideration, and because it's highly contagious like that, it can affect the whole readiness of that unit, the whole combat capability of an entire unit. So these kind of events, these kind of diseases, we call them reportable medical events because they have a significant implication. Reportable medical events are chosen from lists compiled from the CDC, the Centers for Disease Control and Prevention, and the Council of State Territorial Epidemiologists, okay? The CDC and the CSTE, they have a list of things that are required to be reported. Things that, you know, if you go, even if at a civilian hospital, if, you know, you're diagnosed with a certain illness, the CDC wants to know. All right, so from these lists, we came to a tri-service consensus. We looked at the list and we said, yep, we agree these are things we need to report on to our specific entities within the military, and we'll get into those in just a little bit here. We came up with the consensus between the Army, the Air Force, and the Navy, and we published these lists, right? These things that we need to report. So we published the reportable medical events, and they were published by the Armed Forces Health Surveillance Center, and they published them in their own booklet called the Armed Forces Reportable Medical Events Guidelines and Case Definitions, and we'll get into that in just a little bit. But reports of these events, right? So whenever we have something like a tuberculosis, right? Whenever we have a reportable medical event, well, we have to do a report on it, and that report is called a medical event report, and we'll talk about medical event reports in a little bit here. Right here is just a copy of the cover of the Armed Forces Reportable Medical Events Guidelines and Case Definitions. You can get this booklet from the Navy Marine Corps Public Health Center, but in this booklet, you're going to have a list of all the reportable medical events. Not only that, it's going to give you case classifications, right? So how we define a suspected tuberculosis case, how we define a probable tuberculosis case, and what does it mean when we have a confirmed tuberculosis case, okay? And we'll talk about some of these diseases specifically later on in this presentation. A quick review of what we've covered so far, all right? Reportable medical events are chosen from blank and the blank list of national notifiable diseases by tri-service consensus. Who do we go to, or who did we pull our, what two entities did we pull our list from by tri-service consensus to come up with our reportable medical events? Well, we pulled that from the CDC and the CSTE. CDC and the CSTE. Who publishes the agreed upon reportable medical event lists along with specific case definitions? Who published the agreed upon reportable medical event lists along with specific case definitions? That's going to be the Armed Forces Health Surveillance Center, right? The AFHSC, and you can access their website, and that's what the homepage would look like right there. All right, Navy medical event reporting requirements. All right, so when we have to do a MER, when we have to do a medical event report, we've got certain requirements, all right? And these requirements are laid out in BUMED Instructions 6220.12. And again, if we look at the instructions, 6, medicine, 2, preventative medicine, the secondary 2, communicable disease, right? That is the BUMED instruction on what are the requirements for medical event reports, okay? So BUMED Instruction 6220.12, any medical event that meets the definition of a reportable medical event must be reported. Any case of novel influenza A must also be reported, and we're going to talk about novel influenza A a little bit towards the end of this presentation. All right, we've got certain deadlines depending on the type of reportable medical event we're dealing with, and we're going to split it into two different types. We've got an urgent and we've got routine. An urgent reportable medical event is a condition that we need to report within 24 hours. A routine reportable medical event, that would be something that we can report no later than 7 calendar days. The reporting methods, the preferred reporting method is through what's called the Navy Disease Reporting System Internet. Okay, this is the Navy's official system to submit, view, and track a medical event report, right? And you can access this through the Navy Marine Corps Public Health Center. But typically, the person that's going to have access to this is somebody either working in the public health department within the hospital or a PMT, a preventative med technician assigned to the unit. All right, all shore-based MTFs and operational units with an PMT should be able to use it. They should have access to it. If you don't, if you're in a small operational unit, there's other ways of reporting, right? You can report via phone, you can report by a naval message, and you can report by an email. And what you would do is, if you looked in the back of this manual that we're talking about, you can look in, I believe it's Appendix B, and Appendix B and D, and it gives you the format that you would use to submit a MER, to submit a medical event report, and you would send that information to the nearest Navy Environmental Preventative Medicine unit that's responsible for your area of operation. And the very last page of this manual, it has a list of all the NEPMUs and where their addresses are, what their contact numbers are, and that's who you would submit it to. All right, syndromic and category injury surveillance. All right, so monitoring for specific pre-diagnostic syndromes and injuries occurring in specific populations to identify important clusters of disease, injury at the earliest time possible. Okay, so what this is saying is, what we're doing with surveillance is we're looking for a trend in symptoms. We might not have a diagnosis, right? We have several people coming in who are just, fevers and vomiting, right? That's a symptom. We might not have a diagnosis yet. We might have pending labs or something going on. So we're just we're tracking these symptoms and seeing if we see a trend. We're looking for evidence of biological weapon attacks, natural disease outbreaks, forced health protection breakdowns, all right? Are people not washing their hands appropriately? Or is water chlorination not occurring the way it needs to happen? So this surveillance is also used to be known as disease non-battle injury, DNBI, but a lot of new publications, especially this one right here, we're starting to refer to it as just disease and injury surveillance. You still see it, especially if you look at like Chapter 9 of the P5010 of your preventative medicine, right? It's going to refer to this as disease non-battle injury, but newer publications, we just call it disease and injury surveillance. This table here I pulled from the textbook of military medicine on preventative medicine, and it's just to give you an idea of the significance of disease non-battle injury, why we're monitoring for it. So throughout history, the history of America's wars, you're more likely to die, right? You're more likely to get killed from a disease or a non-battle injury than you are from actual battle injury. If we look like on the Mexican War here, right? 11,000, right? 11,000 disease non-battle injuries compared to 1,733 battle injuries. It's clear up until World War II where battle injury finally outnumbered disease non-battle injury. So that's just to give you a little bit of context, right? Why we care about disease non-battle injury, or as we call it now, disease and injury surveillance. All right, so disease and injury surveillance reporting methods. So we have electronic methods, and we have manual methods. We're going to go into electronic methods first. Electronic methods are the preferred methods, and the reason being is if we can get it into the military health system repositories, if we can get it in there, there's a lot of analytical systems such as the electronic surveillance system for early notification of community-based epidemics, okay, or ESSENCE. And ESSENCE is a tool that we can use to quickly identify trends. ESSENCE is something that's going to be monitored by public health officers at military treatment facilities and other public health staff, and it's going to raise alarms. It's going to say, whoa, 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 we're having way too much of a certain symptom, in this area than we normally would. So if we can get our disease and injury reporting into an electronic format and we can get it to the military health system, they're going to plug it into a system like ESSENCE, and it's going to quickly identify, if something abnormal is going on, and get us, alert the unit and let us know that, hey, we need to do some sort of investigating into what's going on, what's causing these injuries or causing this illness. On the other hand, if you did not have access to the electronic system, to the MHS repositories, you would have to do it by a manual method. So a lot of times small operational units, they still are responsible for compiling and submitting data on disease and injury surveillance, but they're going to have to do it manually. And they can get the information and the resources they need from the Navy Marine Corps Public Health Center. If you go to the Navy Marine Corps Public Health Center, you're going to find the latest disease and injury spreadsheet template. All right, and you would use that template, and that template's going to look like this right here. All right, just to get you oriented real quick, you'd put your unit name right here, the fleet, your location, the home port. This is really important. You got to put the total strength, and we'll get into this in a second, but this thing is auto formatted. Okay, so you got to make sure you ensure the report identifies the entire population at risk, right? And the reason being is it's going to let you know your percentage. When you start plugging in, unexplained fever or influenza-like, symptoms for your weekly visits, Sunday, Monday, and so on and so on. It's going to auto calculate your total, but not only that, it's going to give you your percentage, and it needs to know your total strength in order to do that. Not only that, it gives you your expected rate, and then it gives you your suspected action level rate. So if you start, like for fever unexplained, for this particular spreadsheet, if you get to 0.04%, you might need to do a little bit of investigating. You might have to actually submit a MR. All right. And Appendix E of this manual will give you specific definitions of these syndromes and these injury categories. Okay. It tells you specifically what we consider like infectious gastrointestinal disease. Okay, like fever with vomiting and things like that. We're not too worried about things like, GERD. It'll give you very specifics on all of these. All right, and if these rates right here exceed, right, the suggested action level, that's when we got to make a decision to submit a medical event report and do an investigation, and we can look into Appendix F for further guidance on that. Classification. So when it comes to our medical event reports and our disease and injury reporting, typically we can send those unclassified. But if you find yourself in a situation where it might have an adverse effect on the unit's operational security or national security, you should consult with your information security manager and your commanding officer so they can help you make a classification decision on those reports. If you need consultation, if you need help with certain things as it pertains to disease surveillance, well, your go-to resource is your Navy Environmental Preventative Medicine Unit, who's responsible for the area you're operating in, right? They're the Navy's primary consultative resource for disease and outbreak confirmation and response, reporting assistance, public health and lab support and sample collection, epidemiological study designs, and disease surveillance and response training. All right, some quick review of what we've gone over here. What is the Navy's official system to submit, view, and track a medical event report? What is the Navy's official system to submit, view, and track a medical event report? That is the Disease Reporting System Internet, the DRSI. How quickly should an urgent medical event report be submitted? How quickly should we submit an urgent medical event report? We need to do that within 24 hours. How quickly should you submit a routine medical event report? A routine medical event report needs to be submitted within 7 calendar days. If required to do a manual disease and injury report, when are they typically due? When are they typically going to be due? They're going to be due on the Monday following the end of the report week. So the Monday after you finish the report. All right, in this manual we have a page dedicated to Influenza A novel, right? A different type of Influenza A. So we have different types of influenza. We have A, B, C, D. Influenza A is what's known as avian flu. So clinical description of Influenza A, it's an illness compatible with influenza virus infection, fever usually greater than 100 degrees Fahrenheit, with cough and or sore throat. Laboratory criteria for diagnosis, right? So we're a human case of infection with influenza A virus subtype that is different than the current circulating influenza H1 or the H3 subtypes, okay? So we have 2 types of influenza A we typically see, all right? And these numbers, like we've got the H1N1 and the H and the N, they designate 2 proteins on the virus's wall, on the outside of the virus. So we've got H1N1 and we have H3N2. Those are the normal influenza A's we see in the population. Those ones are okay. A novel case is when we start to get anything different from this, okay? So novel subtypes include, but are not limited to, if we saw like an H2, an H5, an H7, or an H9. Or if we had an influenza H1 and H3 subtype originating from a non-human species, those are also considered novel types. Confirmation of a novel influenza A virus will be done by the CDC's influenza laboratory, okay? So we got to go to the CDC to confirm this, and they're going to do it more than likely by an RT-PCR, or a real-time reverse transcriptase polymerase chain reaction. That's the lab they're more likely to use to confirm this influenza, this novel influenza. All right, so exposure. Exposure, we're going to be worried about exposure if the patient has contact with one or more patients who's either have or had the disease, and transmission of the agent by usual modes of transmission is plausible, okay? So they come into contact with somebody that was diagnosed with novel influenza A, and they, they're within, coughing or sneezing distance. Laboratory testing for case classification should use methods that are mutually agreed upon by the CDC and the CSTE, and those are going to include viral isolation, the RT-PCR, gene sequencing, and a fourfold raise in strain-specific serum antibody titers, meaning they would draw your blood to see if you've got antibodies to that strain of flu, and if you've got a fourfold raise, right, 4 times what the expected amount is, then they would consider that a positive for, having influenza, a novel type of influenza A. All right, so case classification. We're going to classify our cases as suspected, probable, and confirmed. We're going to say a case is suspected if a case meets the clinical criteria but has pending laboratory confirmation. We don't have the labs back yet. Any case of human infection with an influenza A virus that is different from the current circulating H1 and H3 viruses. A probable case is a case that meets clinical criteria and is epidemiologically linked to a confirmed case. So you've got the symptoms that we're seeing with this novel influenza A, and you've been exposed to somebody that we know for sure has it, but we don't have your lab back yet. So we don't have a confirming lab for the individual yet. It's being performed, or the test results were inconclusive. And then a confirmed, that means that the virus was confirmed by the CDC's influenza laboratory. Okay, and that's an important point to remember, right? It's the CDC's influenza laboratory that confirms influenza A. Or sorry, excuse me, novel influenza A. Normal influenza A, no big deal. But if you have a novel strain, right, something different than the H1 and the H3 that's circulating, then that's a big deal. That requires a MER, a medical event report. To wrap up this presentation, I'm going to go over the urgent reportable medical events, right? The reportable medical events that require a MER, a medical event report, in 24 hours. You have a list of several of these, right, for our routine, our the ones that we can do in 7 days, but I don't want to cover the whole list. And a lot of times the way these things are put into a test question is which of the following requires an urgent MER, or a MER within 24 hours. So anthrax, if somebody got anthrax, we got to report that within 24 hours. Botulism, diphtheria, hemorrhagic fevers, novel influenza A, malaria, measles, meningococcal disease, outbreaks or disease clusters. Okay, so if we have an outbreak within the unit, that requires an urgent report, a 24-hour MER. Plague, if we had poliomyelitis, rabies in humans, severe acute respiratory system, or SARS, smallpox, tuberculosis, and tularemia, right? Especially tularemia, smallpox, anthrax, those are plague, or botulism even, right? Those can all be, the signs of a biological attack. So that's another reason why those would require an urgent MER. Not only are they, debilitating diseases, but they can indicate a biological report or attack as well. All right, that wraps up this presentation. The references for this were the Navy Marine Corps Public Health Public Health Center Technical Manual 6220.12, the Center for Disease Control, Textbooks of Military Medicine, Preventative Medicine, and the Navy and Marine Corps Public Health Center. Like always, I hope this helps, and keep studying.